Dr. Tyler J here for our next session. Today we're diving into a real and necessary conversation: trauma and Black bodies. We're talking about how history, healthcare, and lived experiences all come together and sometimes collide in the everyday lives of Black people. This isn't just about what happens in hospitals or clinics. It's about the weight of generational pain, mistrust, resilience, and how it all shows up in our bodies. We're looking at it through the lens of medical anthropology. So we're asking bigger questions about culture, power, and healing. Here's the definition of medical anthropology. It examines how cultural, social, biological, and political factors influence people's experiences of health and illness and their interaction with healthcare systems. Acknowledging the collective trauma and pervasive culture of mistrust is the basis for this conversation. Since slavery, generations of African Americans have experienced trauma perpetuated by systemic racism, leading to health disparities, economic disadvantage, and societal neglect and abuse. The social drivers of health are the conditions that places where one lives, works, and plays. These factors ultimately influence one's ability to thrive. Historically, African American communities experience persistent poverty and are subjected to food insecurity, lower socioeconomic status, and lack of transportation. This leads to health inequity and disparity. Structural racism has shaped standards of medical representation and anatomy, leading to white, heteronormative perceptions of humanity. Here are a few systemic instances where we see the devaluation of Black bodies. Chidiebere Ibe illustrated the first Black fetus representation in medical literature, challenging the normalization of white bodies as a frame of reference. The new Jane Crow era symbolized a time of massive assault on Black women's fertility through forced sterilization and controlled population methods. For centuries, Black bodies have been considered sites of disorder and experimentation, as we saw in our previous class on medical mistrust. Blacks were considered expendable, denied humanity, and healthy treatment. The pain tolerance treatment disparities that persist within Black patients who often are left to experience measures of self advocacy. In these instances, they are often labeled non compliant and exhibiting drug seeking behavior. Trauma informed care for Black people, like all trauma informed care, focuses on acknowledging the impact of trauma on individuals and systems and on creating environments that are safe and responsive to those experiences.